Good afternoon, everyone. Thank you for joining our caregiver education and training for today. This session is being recorded and will be posted to our St. Barnabas website under the Family Caregiver Support Program section. Today's presentation, I'll be discussing depression and caregiving. My name is Olga Yamawaki. I am one of the case managers here at the Family Caregiver Support Program in St. Barnabas. I just want to quickly introduce our team at the Family Caregiver Support Program, composed of Amy Blackburn, Program Manager, Michelle McGuire, one of the case managers, and our new case manager, Valerie Moreno. So for caregivers, depression is more common than you might think. And it's a normal response to a difficult situation that they're dealing through on a daily basis. So it's not unusual for caregivers to develop mild or more serious depression as a result of the constant demands that they face while providing care. Depression is an extremely complex condition. There's many research studies underway to pinpoint the cause or causes that individuals get depressed or feel depressed. Some people don't describe themselves as feeling depressed. Some of them don't even recognize the symptoms in themselves of depression. Some of them might have a hard time admitting that they feel depressed. They're embarrassed to talk about it. They might feel like a failure or, fearful that people will judge them because they're having these feelings that they can't, sometimes describe. And everyone has negative thoughts or feelings that come and go over time. But when these feelings become more intense, and it may be a warning sign of depression. And unfortunately, feelings of depression are often seen as a sign of weakness in our society, rather than a sign of something that's out of balance with the individual. Comments from others such as, oh, you'll snap out of it, or it's all in your head, they're not helpful, especially for caregivers who are dealing with a lot. And it reflects a belief that mental health concerns are not real. So ignoring or denying your feelings will not make them all go away. It's just gonna make things harder on yourself, and it could make things worse as well. Some contributing factors of symptoms of depression are genetics, change in hormones, your environmental triggers, especially if you're a caregiver. Some medications and side effects of medications as well can trigger some are factors for depression. The effects of living with a major illness. A lot of caregivers themselves are dealing with health issues. So that's just an added on task that they have to deal with. Grief and loss of a loved one who has passed away. Experience physical or emotional abuse can also be a contributing factor for depression. And not everyone will experience the negative feelings to go with depression. But we know that in an effort to provide the best possible care for a family member or a friend, caregivers often sacrifice their own physical and emotional needs. The complex and varied aspects that are involved with providing care can strain even the most capable person. Some symptoms of depression. People experience depression in different ways. The type and degree of symptoms can vary with individuals, and they can change over time as well. We can consider some of these symptoms, and if anybody has experienced the following for longer than 2 weeks, try to get some assistance or help. Feeling of sad, tearful, empty, hopeless, changes in eating habits, This could be weight loss or no appetite, changes in sleep, you're sleeping too much or not getting enough sleep, feeling tired all the time, you're having difficulty, being motivated to do the things that you used to do at one time or another, a loss of interest in people or activities, feeling numb, becoming easily agitated or angered, feeling that nothing you do is good enough, increase in alcohol or drug consumption, excessive time on the internet, if you're having trouble focusing, thinking, or planning, as if your head is filled with fog, neglecting your own physical well-being and appearance, thoughts of running away or escaping from the situation, thoughts of death or suicide, and even ideas of how to end your life. Ongoing physical symptoms and do not respond to treatment, such as headaches. So ongoing physical symptoms, and they're not responding to treatment if you're having excessive headaches, digestive disorders or chronic neck and back pain, even if you're, taking medication for it and they're still persistent. Some special caregiver concerns. Caring for a person with dementia. Researchers have found that a person who provides care for someone with dementia is twice as likely to suffer from depression. Dealing with dementia-related behaviors is an even bigger contributor to developing depression. It is critical for caregivers, especially in these situations, to receive constant and dependable support and respite, which for some caregivers that could be difficult as they don't have that family support to assist them in their needs. Also, women experience depression at a higher rate than men. Women, primarily wives and daughters, provide the majority of caregiving. In the United States, approximately 12 million women experience clinical depression each year, at approximately twice the rate of men. For some women, also physical factors like menopause, childbirth, PMS, thyroid disease, and some nutritional deficiencies, such as in iron, vitamin D, and omega-3 fatty acids, can also cause some depression. Men who are caregivers deal with depression differently. Going back to women real fast. There was a study by the Mental Health America that found that many women do not seek treatment for depression because they are embarrassed or in denial about being depressed. And in fact, 41% of women surveyed cited embarrassment or shame as the barrier for them seeking treatment for their depression. Men who are caregivers deal with depression differently. Men are less likely to admit depression, and doctors are less likely to diagnose depression in men. Men will more often self-treat themselves and their symptoms, their depressive symptoms, with alcohol or overwork. And the assumption that depressive symptoms are a sign of weakness can make it especially difficult for men to seek help as well. Military and veteran caregivers are at risk of depression. Military and veterans experience depression nearly twice the rate of non-military caregivers. They can be suffering from other conditions such as dementia or traumatic brain injuries or post-traumatic stress disorders that can be particularly challenging for some of the caregivers as they're dealing with their own traumas and then they're having to take care of their loved ones. Lack of sleep also contributes to depression. And while sleep needs may vary depending on the individual, most people need 8 hours a day. Loss of sleep as a result of caring for a loved one can lead to serious depression. Depression can persist after placement in a care facility. For some caregivers, making the decision of placing their loved one in a facility is very stressful. While many caregivers are finally able to catch up on needed rest, the loneliness, the guilt that comes with placing someone, and also having to monitor their care while at the facility is a new added stress to the caregivers. And some people assume that once caregiving is over, the stress of providing the hands-on care will go away. Yet researchers found that even 3 years after the death of a spouse with dementia, some former caregivers continue to experience depression and loneliness. So former caregivers may need to also, seek help for their depression as well. So what to do if you have depression? Depression deserves the same treatment, to be treated the same way as any other illness, such as diabetes or high blood pressure. The best way to figure out what is causing the symptoms is to talk to a qualified professional, such as your doctor. If you feel uncomfortable using the term depression, you can always tell your doctor that you're feeling blue or you're feeling down. Describe your personal experiences and symptoms. Try to be as specific as you can and as honest as possible. That way the doctor will be able to really assess you and try to assist you as best as possible. How is depression treated? The first step to getting the best treatment for depression is to meet with a mental health professional. This could be a psychologist, social worker, or a licensed therapist. At the same time, scheduling a physical with your primary doctor that would consist of lab tests, such as, because certain medications, as well as some medical conditions, such as a viral infection, can cause some same symptoms as depression. So it's better to, get some lab test done. Also, they might interview and do a mental status test, and it'll determine if speech or memory or any thought patterns have been also affected. And although some doctors might prescribe antidepressant medication, medication alone is not the most effective treatment for depression. They recommend the concurrent guidance with the mental health professional along with antidepressants. It's more beneficial for the patient because when you're talking to a therapist, they will listen to your concerns, they will screen your symptoms, and they will assist you also in developing ways to address your stress and learn coping skills to deal with some of the stresses in your life. Some of the treatment options, primary treatment options are psychotherapies, speaking to a professional therapist, and antidepressant medication. These treatments can be used alone or in combination with one another, which, again, they recommend you use if you are on our medication, also talk to a professional, as you're getting the more benefits using both. When choosing a therapist, ask about their experience working with family caregivers, their understanding of caregiving related stressors. That way they'll be able to assist you and give you more personal advice as to what your needs or what you're going through. If medication is recommended, it might take several weeks for it to actually have an effect on the individual, as it's always, trial error, finding the right dosage or the right type of medication for each individual. Also, some complementary and alternative therapies. Many complementary medicines and alternative therapies are promoted for coping with depression. These could be physical exercise, mind-body techniques, and supplements. So for physical exercise, exercise has been found to reduce the effects of depression. Walking 3 times a week for 30 to 45 minutes has been linked to reducing or alleviating some of the symptoms of depression. If that seems too much for you, like you don't have enough time, I know a lot of caregivers are really busy. They're like, oh, I could do a lot in 30 to 45 minutes. Start with 15 minutes once a week. And just, the message is just to get started on a regular exercise activity. And once you get started, you get that motivation of continuing it. Also, put it on your to-do list. A lot of the caregivers have a to-do list, so add it in there, 15 minutes, once a week. And don't check it off until you're done it. It'll encourage you to implement it and start doing it. Arranging a time with a friend, ask them to give you a walk date each week. They can come maybe sit in with the caregiver for 30 minutes or those 15 minutes that you want, if you want to do it every day. Somebody that you can trust and be there for you as well. Mind and body techniques. There is a growing body of research showing that our thoughts, beliefs, and feelings can have a direct impact on our health, and our physical health can have an impact on our mental state. Our mind and body are interrelated. So implementing mind and body techniques into your routine may help to elevate some of the symptoms of depression. And even, 5 to 10 minutes of these techniques may help relieve some of those symptoms. And you can even do this from the comfort of your home. Meditation, prayer, deep breathing, acupuncture, yoga, massage, listening to music, creating art, guided imagery, or even journaling. I know some of the caregivers that like to journal. And there's a lot of apps out there too, and a lot of free websites and products that you can use at home to do some of the meditation, to do some of the deep breathing. It's harder now to go out and get a massage since COVID-19, but you can do a lot of these things at home, and it takes only 5 minutes. And sometimes that's all it takes for a caregiver, to disconnect for 5 minutes. Supplements. I've gone over, we did a presentation on supplements. So these are, over-the-counter supplements. There's some research that's been shown that St. John's wort, SAMe, and omega-3 fatty acids are under study and are unpopular amongst individuals for treating depressive symptoms. However, the FDA doesn't control the amount of ingredients that are going to this supplement. So, make sure you do your research before you do decide to take any supplements. Just the US FDA issued warnings stating that St. John's wort may affect your body when you're taking prescription drugs and for some treatments of illnesses such as heart disease, depression, and some HIV infections. So always make sure to talk to your doctor if you are going to implement any of natural remedies or natural supplements in your diet, especially if you have underlying health conditions. Paying for treatment. Some private health insurance and Medicare may provide some mental health care for individuals. Also, if the caregiver is employed, they may also have access to an employee assistance program through their work, where a licensed professional is available to, for confidential sessions to discuss either personal or professional problems. There's also I skipped one. Some professionals also can offer a sliding scale fee. This is for caregivers who don't have health insurance and are paying out of pocket. Fees can vary depending on the professional. So with the sliding fees is, what it means is that the professional may slide their fees down to meet the individual's need. There's also free clinics that individuals can access that, I'm sorry, not free, low fee clinics that individuals can access as well. They have a set low fee that will apply based on the availability for the individual to pay. There's also free programs out there that caregivers can have access and speak to a professional. I know for our program, we have a lot of resources for caregivers that, you know, are feeling depressed and want to speak to someone. We can be able to refer them to professionals that can help them in their caregiving roles. Some strategies to help yourself. Depressive disorder can make one feel exhausted, helpless, and hopeless. Such negative thoughts and feelings can make some people feel like giving up. It is important to realize that these negative views are only part of the depression and they don't accurately reflect the situation that the individual is dealing with. So these guidelines are adapted from the National Institute of Mental Health and are recommendations for dealing with depression. So you gotta remember, you know, gotta set realistic goals. As an individual dealing with depression may not be able to accomplish as much as they're accustomed when they're feeling well and not having this symptoms of depression. So try to break your large task into small ones. You know, set some priorities of what you can and cannot accomplish. Try to be with other people and confide in someone that you know and you trust. It's often, you know, better to not suffer alone. Participate in activities that make you feel better. This could be, again, exercise, going to the movies, a ball game, attending religious or social or community events. That could be a little hard right now with the COVID situation. Everything's closed and we can't really gather. But there's, you know, you can find online activities that you can do or find something that you are, that makes you happy in crafts, even crafts at home. Expect your mood to increase gradually and not immediately. This is, you know, it's going to take time for you to start feeling kind of back to normal or the way you used to feel before. Postpone any important decisions until the depression is filled. You know, changing jobs or getting married or getting a divorce. Just kind of hold on, you know, big decisions that are going to affect your life in the long term. Talk to someone that you know, that knows you well, and, you know, get advice from them. If, you know, they know you well, they can tell you, you know, if you're making the right choices or decisions. Positive thinking and the practice of new coping patterns will replace the negative thinking, and that is part of the depression. Say yes to offers of help, you know, from family members that you trust. If somebody offers, you know, to come and, you know, watch your loved one for an hour, take advantage. Don't feel guilty. I know a lot of caregivers are like, oh no, you know, I can't leave them alone, or, you know, 1 hour, it's nothing's gonna happen. So just take advantage of those moments that you do have somebody willing to come and help. Also, direct assistance in providing care for your loved ones, such as respite care, relief, as well as positive feedback from others, you know, positive talk, and recreational activities are linked to lowering levels of depression. Look for classes and support groups through, local community resources as well. For your health and the health of, those around you, try to take some time and care for yourself. You're no good to your family member if you are sick and you're not doing the best job that you can. I know caregivers try to do their best, and sometimes they forego their own needs because they're too busy taking care of the needs of their loved ones. And here are some resources that you can go on if you're trying to find a professional in your area. And again, you can always look for resources through community resources as well that can refer you to specialists and can help you deal with your symptoms or your depression if you are feeling depressed. Okay, and that is all. If you guys have any comments or questions.
Hey, Olga, what is SAMI, the supplement you mentioned?
Sorry, that's a good question. I forgot it. I forgot to Google it. I was going to Google it before I did it. But it's supposed to help with depression as well. I'll research it and send it to you guys.
Okay. Does it have something to do with omega-3 since you mentioned it with that?
I think it might be related to it. Yeah. Maybe I should Google it.
And then did you find any, as far as statistics, any cultural differences? Like, say, when women feel a certain stigma associated with it?
There wasn't a lot of statistics dealing with culture, but from experience, I know a lot of, like, the Hispanic community, they see it as a taboo, kind of like it's in your head, like it's just in your head. You're not depressed. Like, depression doesn't exist. You're just kind of going through emotions, but it's not something that we are used to seeking help for. You kind of just, you'll get over it.
Yeah.
And again, that's why a lot of individuals don't seek the help that they need, because, the stigma that there might be something.
Did you, I know you mentioned clinical depression, but did you read anything about the difference between, like, acute depression, like caused from grief or something, like a death in the family, or like if it does turn into clinical depression, is there a difference, like in the time and stuff?
No, they really didn't mention like a time frame where it leads from, like, feeling depressed to turning into clinical depression or mild.
Okay, because I know there is a certain time frame, like once it's, like if you're depressed for a certain period of time, it does become like
more
like clinically depressed eventually.
Yeah,
I don't remember the time though.
Yeah, I didn't mention time frame as to the levels of, or when it becomes more clinical.
This is related to the topic I'm going to talk about next week too, resilience and mindfulness, because that's something that can actually help a lot with depression and feeling better. You mentioned meditation, and that and deep breathing, and that does have a lot to do with mindfulness, and resilience are directly related to each other, I'm finding, as I'm doing some research on that. So it's interesting.
Yeah, and now with, COVID, there's a lot of applications that you can download that will kind of teach you little techniques on how to meditate, how to do deep breathing. I downloaded one, I don't want to say it, but I'm using one, and I actually got it because one of our clients suggested it. Because parents it's able to pay for it for 1 year.
Oh.
So I downloaded it, and I mean, you have options of a free trial, they do have some free, but it's very limited. So you kind of have to buy the subscription to actually get the full access to it. But it's really good. It has meditation for sleep, just daily 3-minute meditation.
So you have the limited access right now?
I had to purchase the yearly subscription. So
okay.
be able to get full access to it.
Okay.
Yeah, because the free, you can download it for free, the app, but it's very limited.
Oh, okay. Cool.
So I tried a few, and I was like, oh, okay, this is working. I like it. So that's why I bought it. But it's
yeah, I'm glad you mentioned that when you do start implementing self-care activities and being proactive about getting out of that depressive state, it is very gradual, especially when people, and a lot of caregivers are experiencing grief, and it's that grief and that loss of the person they're caring for, who they were before, type of thing, where it just kind of builds on itself and they get more and more depressed. And COVID right now definitely isn't helping with that. But I know after my mom died, it was a very, very acute depression, very intense for 3 to 6 months. And during that time, when you are in that depressed state, it's like, for me, and probably for a lot of people, you can't do a lot of the things you normally would do to make yourself feel better. Like my favorite things to do, like listening to music, watching movies, exercise, I wasn't able to do anything. It was like I was frozen, and those things that I normally enjoyed, I couldn't even do. So that's another thing, and that's something I'll be talking about next week, is having that self-awareness and where you are at in your life, and being able to implement other things into your life. For me, a big factor during that period was my own family, and being able to have that support with my family, and just that interaction. So it's also an ability to, with that self-awareness, is realizing what things will help you during those times in your life. I think a lot of people right now during the pandemic and the increased isolation, I think more people are depressed than they even realize, because there is that, not as much interaction and everything, and you're not able to do the activities you would normally do. So that's another part of that self-awareness and mindfulness and building up that resilience.
Yeah, and then finding, other things to do, okay, then, what can I do at home to kind of fill that void and my interest, and,
right,
yourself and your mind busy. Yeah, so just finding those techniques and the resources, I think for a lot of people during this time will be very beneficial.
Yeah, and it's interesting too, because we're all in a position now where most family caregivers at home have been the entire time they've been caregivers, you know, not able to get out, they're isolated, not able to do the activities they normally enjoy. So we're all kind of gaining an understanding about what family caregivers have been going through this whole time, you know. So I've wanted to have like focus groups and interview caregivers, like, okay, now that you guys are in this situation that everybody else is now dealing with, are there tips you can give for us, type of thing? You know, I wish there was more like interaction in that aspect. Like a lot of organizations are doing all these presentations on staying at home and the isolation and this and that, and but I think there needs to be more, and maybe our program can do it more, almost like interviewing of caregivers and their resilience and how they've been able to overcome and maintain their own health and stuff. What do you guys think?
That would be interesting.
Yeah, we could do a little mini evaluation.
Mm-hmm.
Yeah, get like a little focus group together.
Do a survey and interview them, have them rate themselves, maybe do some scales.
Mm-hmm. Do an online Zoom focus group.
Yeah. Juliet, does that sound like something you might be interested in doing? I don't know if you're still listening.
Yeah,
As a care.
I'm listening. I think that's great. Yeah, I think that's a great idea.
Yeah.
Yeah, I like more interactive stuff than, I mean, scales are good too, but you know, just talking about it.
That's great.
Yeah, focus groups are always good. All right. Any other comments or questions?
I just had one, like, how, you know, maybe I think Amy talked about this a little bit. How do you know if someone's going from mild to major, you know, or just like a situational thing, like the fires can cause a little more depression because you can't go outside and walk and exercise, and it's going away, but it's not going away. So it's more like short term, or how does that, I think something Amy said too, like you can easily not know it. And most people, I think with COVID aren't aware of it. And your slides had that too, but anything talking more about kind of how can you stop it before it starts to get into a major depression, you know, like, and what are the stages of just kind of a minor, you said 2 weeks, you've got symptoms, but then all of a sudden a whole year goes by and you're in a pandemic or something, you know?
You know, for me, if I can jump in, Juliet, for me, it's the level of functioning. You know, like Amy was saying, when she was in an acute state after her mother's passing, she wasn't able to even function. She couldn't do any of the things that she liked to do. And, you know, maybe at a less acute level, she'd still be able to do them, but maybe she wouldn't enjoy them anymore. Or maybe she'd have to push herself a little more to go. You know, so it's kind of, the levels of functioning can kind of parallel your level of depression, if that makes any sense.
Yeah, that makes sense.
Yeah. So like if you start, like I mentioned, if you start having those symptoms or those thoughts for, 2 weeks, kind of keep in mind that might be a sign for you to start, maybe talking to your doctor and before getting worse. So I think seeking help at the beginning will kind of limit the state to eventually reach that mild or more severe depression.
Mm-hmm.
And if you're curious, you could always find a professional, a clinician, or maybe even a resource online if it was a good resource, a credible resource online to give you some kind of assessment, so you can find out yourself, am I depressed, even mildly depressed? Because as a caregiver, Juliet, you're at risk, you're at higher risk, so I don't know if that's an issue for you, but it's just something to think about.
Yeah, and the social supports make a huge difference. They actually, it's a age gauge, like what's your real age and your lifespan expectancy, and having that social support. Like when I took that test with all of the healthy things that I've done throughout my life, because I don't have any family nearby, and it's the family's social support that makes a big difference. It decreases your lifespan, your life expectancy by like 10 years. It's crazy, because when things like that do come up and you aren't able to do those things, it's those supports from your family that really do make a difference. So I know when I stayed with my family during that time, like when my niece would stick little notes under my door and say, dinner will be ready in 10 minutes. We're having chicken and rice, you know, little things like that throughout the day that just make a difference in your life and kind of build you back up. So.
Great.
All right. Is that it, Olga?
Nobody has any more comments? Stop the recording.
All right, I'll go ahead and stop the recording.